Welcome to QuickMed Academy, where complex medicine becomes clear in just a few minutes.
Let's talk about heart failure. It's one of the most common cardiovascular conditions in the entire world, and a huge reason people end up in the hospital. But here's the thing. The name itself is incredibly misleading. So what's the very first thing we need to get straight about it? Yeah, when you hear that term, heart failure, what do you picture? Your mind probably jumps to something really sudden and dramatic, right? A heart that just stops working. But that's not what's happening at all. So, to be super clear, does heart failure mean the heart has stopped? Absolutely not. The name is just plain wrong, and the reality is so much more nuanced. And honestly, getting this one difference is the key to understanding everything else. And that is the crucial point right there. It's not about stopping, it's about struggling. The heart is still beating, it's still working, but it's just not doing the job as efficiently as it needs to. Think of it less like a sudden power outage and way more like a persistent brownout. To really wrap our heads around this, let's use a simple analogy that works perfectly. Imagine your heart is this powerful, sophisticated pump, and all your blood vessels are the network of pipes delivering vital resources throughout a city, which is your body. Well, heart failure is what happens when that central pump starts to lose power. So, to put it simply, heart failure is a condition where the heart's pump can't generate enough force to push blood out the way it's supposed to. And that means the body's tissues and organs just aren't getting the oxygen and fuel they need to function properly. This whole struggling pump thing creates a two-part problem. First, there's what we call a forward failure. Not enough of that good oxygenated blood is getting out to your muscles and organs. And second, there's a backward failure. Blood starts to back up in the system, like a huge traffic jam, causing all this congestion behind the weakened pump. Now, here's where it gets really interesting. This pump failure isn't just a single issue. It can happen in two fundamentally different ways. See, it's not just about the pump being weak, it can also be about it being too stiff. And this lays out the difference perfectly. On one side, you've got systolic failure. Think of this as a weak pump or a can't squeeze problem. The heart muscle is just too weak to contract properly, so it can't push enough blood out. On the other side, you've got diastolic failure. This is a stiff pump or a can't fill problem. Here, the muscle is so stiff it can't relax, which means the chamber can't fill up with enough blood in the first place. So two different mechanical problems, but the exact same end result: less blood getting pumped out to the body. So when the pump starts failing and blood starts backing up, what does that actually feel like? This is where the symptoms come in, and they're a direct result of that traffic jam we just talked about. Let's trace how this backup causes problems. If the issue is on the left side of the heart, pressure starts to build up in the pipes leading from the lungs. That pressure forces fluid right into the lung tissue itself. And the result is a classic set of symptoms. You start to feel breathless because your lungs are literally getting waterlogged. It can become really hard to lie flat because gravity just makes the fluid settle even more. And since your body isn't getting enough oxygen, you feel this deep, profound fatigue and find that even simple exercise is just completely exhausting. Okay, so what if the backup is on the right side of the heart? Well, in that case, the pressure gets pushed back into the general circulation, into all the pipes leading back from the rest of the body. The consequence of this is visible swelling, something doctors call edema. Fluid leaks out of the vessels and just pools in the body's tissues. And thanks to gravity, you'll most often see this swelling in the legs and ankles, but it can also show up in the abdomen. Now, you'd think the body would have some brilliant system to fix all this, right? Well, it tries, but its short-term solutions end up creating a much, much bigger long-term problem. So, when the body senses that blood flow is low, it triggers an alarm. And what's its go-to solution? It starts to retain salt and water to increase the amount of fluid in the pipes, thinking that more volume will somehow solve the pressure problem. And this kicks off a really vicious cycle. The heart is already struggling. The body responds by adding more fluid to the system. This increased volume just puts way more strain on the already overworked pump, and that causes it to weaken even further. This is exactly why, if it's left unmanaged, heart failure tends to get progressively worse. Breaking that vicious cycle is absolutely critical. So how do doctors get a clear picture of what's happening and figure out just how much that pump is really struggling? They use a whole combination of tools. It usually starts with a clinical evaluation and a really deep dive into your medical history. Then they'll use imaging, like an echocardiogram, which is basically just an ultrasound of the heart that lets them actually see the pump in action. And finally, lab tests can detect specific markers in your blood that pretty much signal that the heart is under stress. So if there's just one thing you take away from all of this, it's this. Heart failure is not about the heart stopping. It is a chronic condition where the pump is either not strong enough or not flexible enough to meet the body's needs. Understanding this mechanism, the struggling pump, the backup of fluid, and the body's own counterproductive response, that's the first huge step. It shifts our focus from thinking about a sudden crisis to a condition that can be managed. And that raises the most important question of all. What can we do to help this struggling pump work better?